Say when. Okay. Well, thanks for joining us, spending your evening with us once again, and anybody at home tuned in, thanks for tuning in. This is like the basic chiropractic education talk. So again, you guys, if you've heard it, pretend you haven't. As we go along, if you have any questions or comments, anything to add, please add it. I usually start out this presentation just by asking people, if you had the opportunity to choose to achieve an optimal level of health and well-being, how many of you would do that? And most people say, yeah, I want to be as healthy as I possibly can. Usually it's 100%. And then I ask the question, what is health? Like, everybody wants to be healthy, but when I ask the question, what is health? Usually you get the crickets. Like, people are, well, I guess I don't know, right? So I always say, let's go to the medical dictionary and look up the definition. So we have two dictionary definitions of health. And Dorland's Medical Dictionary defines health as a state of mental, physical, and spiritual well-being or normal function. And then Webster's defines health as a state of normal function of all the parts of the body. So in those two definitions, there are similarities, and you caught it because I emphasized those two words, normal function. And the reason I emphasize that is because I kind of want you guys to get the idea that this is what we were created to be. This is our normal state, okay? So health is a result of normal function, your body functioning as it was designed to function. So optimal health, meaning the best possible health, comes from optimal function, the best possible function. So usually if I ask a question during this presentation and you don't know the answer, if you say function, you're probably right 80% of the time, okay? So optimal health comes from optimal function, right? So we have to differentiate what is a normal function versus what is a dysfunction, because we've been taught some things and the way we look at things maybe isn't as accurate as it could be. So when we're looking at this list, runny nose, vomiting, sneezing, diarrhea, cough, chills, fever, headache, all those things, when you look at that list, do you see functions or do you see dysfunctions? Most of us look at that list and say, I think those are dysfunctions. If I have those things, I'm probably sick and I'm probably not functioning, okay? But I want to look a little closer at these from the perspective of function. So let's look at vomiting, all right? I got a story for it, of course. Usually I do. But this was back in the late 90s. My mom's side of the family had a big picnic and everybody was there. And grandma's potato salad sitting out on the table in that 90-degree weather. And all the little kids are running around playing in the dirt and running by, sticking their fingers in the food and tasting it. And for some reason, grandma's potato salad is a great incubator for soil bacteria, which cause food poisoning, okay? So after a few hours in the sun, I come by and I take a big glob of grandma's potato salad. I'm eating it. And later that night, I'm puking, food poisoning. So if a healthy person, here's the question, if a healthy person who's functioning at 100% gets something poisonous, like that soil bacteria and their byproducts in their stomach, the normal function would be to get rid of it, okay? That's a healthy response to having that poison in your system. The not healthy response, those people who aren't functioning, they don't recognize that it's there. We have a device or whatever you want, however you want to look at it, in our body that recognizes when there's a poison, and then we have a way to get rid of it, and that's the vomiting, okay, or out the other end. We won't talk about that. But that's a normal, healthy response to somebody having a poison in their system. And if you don't identify that, then you're going to be sick, and that's usually when we end up in the hospital or in the ER getting our stomach pumped, okay? So in that case, you can see how that would be a function, right? And so when we look at it from that perspective, a lot of these things kind of fall in line, like the D word there. The sneezing, very similar. Like if we get something in our nasal cavity that isn't supposed to be there, we have something that recognizes that's not supposed to be there, and then a mechanism for getting rid of it, that sneeze. And that brings us to a cough. A cough, very similar. And again, I got a story for that one, and that was my mom when she was working at BTD. she was in the warehouse. It was very dusty, and she would get dust in her lungs, and she'd have this minor cough, this annoying little cough, and clearing her throat like that. And that was actually a healthy response to getting that stuff in her lungs. That was a normal function because she was able to identify that and get rid of it. But you go into the doctor says anything concerning, and you say, okay, well, I got this cough, and the doctor gives you a cough suppressant, okay, to suppress that cough. Did he just increase your function or decrease your function? Well, he decreased the symptoms, okay, but he actually decreased the function because now you're not getting rid of that stuff, and that stuff builds up in your lungs, and then eventually you got full-blown pneumonia, and you're back at the doctor getting some real drugs this time, in that case, antibiotics probably, okay? So again, in that case, we're looking at a normal function. Are these things pleasant? No. Sometimes they're even a little scary, and we've kind of been programmed with some of these, and especially the scariest one on the list there is the fever. Most people, if you have kids especially, we've been programmed that if your kid gets a fever, you're supposed to give them a Tylenol or a baby aspirin or something to lower that fever, okay? So I don't want to say that we should let a fever run up to 120 degrees and not do anything about it, because that's not what I'm saying, because if you do get a real high spiking fever that shoots up real high real fast, that is a medical emergency. Thank God we got a place for you to go for that called the emergency room. But I want you to be thinking what percent of those fevers that my kid has or that I have are going to be that medical emergency, okay, versus a normal function. So I'll ask the question, do you think a fever has a function in your body? Yeah. And what is it? Well, when you boil it down, the basic function of a fever is to burn off that virus or that bug. So most viruses are temperature specific. They have a very small window of opportunity in which they can operate. So if you raise that temperature up a degree or two, it kills them. And then once it's dead, that fever comes back down. So Harvard did a study on this. This is like over 12 years ago now. But over the course of a 2-year period of time, they had 200 volunteers for this study. And when you came in, you fill out their intake form. If one of the symptoms that you had listed that you had experienced was a fever, you're asked, do you want to participate in our study? If you say yes, you're going to get one of two things. You're either going to get Tylenol every 4 hours, or you're going to get a placebo, which is no intervention or a sugar pill, basically, right? So why Tylenol every 4 hours? Because we know through research that Tylenol reduces the fever, okay? That's not what they were asking. That's not what they were testing. We already knew that. What they're testing is what percent of the time is that a good idea to give that kid that Tylenol, okay? So over that 2-year period of time, what they found was the placebo group, group 2, with no intervention, recovered on average 3 to 4 days faster than the Tylenol group. Why would that be? Okay? They found that 90% of those fevers broke within 24 hours, and 99% of those fevers broke within 48 hours, okay? So with no intervention. So if you think about it, we're saying that fever has a normal function, and if we get exposed to that bug and it's in our system, that's one of the lines of defense, okay? It's like the second line of defense. It gets through the first line of defense. It's a little deeper in the system. The body recognizes that bug is there, and it starts the reactions to spike that fever. So we bring that fever up a degree or two so it's uncomfortable for us, but also for that bug, right? So when we get to that point, that's kind of the decision point. Do we increase our function or decrease our function? If we give that kid that Tylenol, it's going to bring that fever down, and it's going to make it more comfortable for that kid, but also for that bug. Okay, so did we increase the function or decrease the function? We just decreased that function by leveling that temperature out at a nice comfy level for that bug, so now it can reproduce, and after 4 hours, the body tries to spike that fever up again, but we give them that second Tylenol and bring it back down. And we keep doing that over the course of 3 to 4 days, which incidentally is the amount of time that it takes to mount that cell-mediated response. That's like the third line of defense, okay, where we generate those immune cells and then send them to the site of the infection, and they see. And kind of be thinking about that next time that kid's fever is, 100, 101, 102 maybe. That's high, but still not life-threatening, okay? That fever does have of function. So optimal health comes from optimal function, and your body does function 24/7, 365 days a year, right up until the day you drop. And there's something, like we're talking about, that your body has this mechanism to identify and then deal with those stressors. There's something that has to control all those functions, right? So what is it in your body that controls and coordinates all those different cells and all those different functions? It's the brain, right? So the central nervous system, the brain up here, sends those messages down the spinal cord and then out those nerves to all those different parts of the body, telling that heart, okay, here's how many times you're supposed to beat per minute. Here's how hard you're supposed to beat per minute, and all those good things. And you got a nerve that carries a message to your lungs to tell them when to breathe, and to your stomach, and to your liver, and to your spleen, pancreas, literally every part of your body that functions does so because a nerve carries a message for that event to happen. It's not by accident or by chance that your pulse is 62 beats a minute right now, okay? It's because that's what your body needs, and your body is communicating with the brain, and the brain's telling that heart to beat at that rate, okay? So that system there is so important. It's the only system that we have that's completely encased in hard bone. And that's why we have the spine. So, of course, the brain is completely encased up in the skull here. And then the spinal cord and the brain stem completely encased in that plate armor of the spine. And there's 24 individual movable segments that stack on top of one another. And I say movable because if that was a solid column of bone, we wouldn't be able to bend and twist and turn and bend over and tie our shoes and those good things. But that pad in between those bones, that disc, you guys have all heard of like a slip disc, that disc allows us to bend and twist. It does another thing. It absorbs the shock of gravity. But the third thing that it does is the thickness of that disc is what creates that hole at the back, if you can see that, which allows that nerve to come out and carry those messages out to all those different parts of the body. So as long as that system is working the way it's supposed to, in theory, all those messages get from the brain out to the body and body back to the brain, and everything functions as it should be, okay? Thank you. There is a problem. Like we said, though, those parts are movable. And when moving parts move out of place in the spine, we have a special name for that called a subluxation. How many of you guys have heard that before? Yeah. And a subluxation, literally translated, I mean, figuratively translated, it's just that bone out of place, putting pressure on that nerve. But we talked a little bit about this, that sub means less than, lux means light or life, ation means to be in a state of, so subluxation, literally translated, means to be in a state of less than life. And if you think about from a perspective of function, if you're functioning at 100%, like you're 100% alive. If you're functioning at 0%, you're dead, right? So function there equates kind of with life. We found through the American Board of Neuroradiology did some studies, and they found that a misalignment of 1 millimeter in the spine is sometimes enough to actually put pressure on a nerve, just with 1 millimeter of misalignment. So that, in some cases, can be a subluxation. And then the University of Colorado did some studies to find out how much pressure on a nerve root will reduce that nerve's function. And what they found was the smallest amount of pressure that they could put on a nerve, in that case, 10 millimeters of mercury pressure, that was enough pressure on that nerve to reduce that nerve root function by up to 60%, okay, right off the bat. So it takes roughly the weight of a dime to reduce a nerve's function by 60%. And if you think about that, we've got the spine over here with those nerves coming out, carrying those messages out to our kidney. Let's say 10 millimeters of mercury pressure on that nerve on day one, okay? Is that something necessarily that we're going to feel? Not necessarily. Those might not even be pain-sensitive nerves. What percent of the nerves in our body are pain-sensitive, or let's say sensory? Sensory meaning we can sense them in some physical sense. It would be 9% are sensory. And of that 9%, a very small percentage of that 9% are actually the proprioceptors, which are the pain-sensitive ones. Some of those sensory are like hot and cold sensors. Some of them are light pressure or hot, sharp, dull. There's different, and then nociception are those pain sensors, okay? So point being, we can have that pressure, that 10 millimeters of mercury on that nerve and not necessarily feel it as pain. With time, is that something that's going to get better or going to get worse? It's going to get worse. It's called a degenerative process. Degeneration, meaning every generation is going to get worse. So in that subluxation, we've got that disc which damaged, okay? Those disc cells turn over roughly every 4 months. That's one generation. And then we've got that nerve tissue. Those nerve cells degenerate as well. Roughly every 90 days, those cells turn over, okay? So if we've got pressure there and it's choking off circulation or it's choking off nutrient shuttling down that nerve, that nerve and that disc are going to get worse every time those cells turn over. That next generation comes in atrophied, a little smaller, okay? So now it can carry less messages out to that kidney, and now that kidney starts to degenerate, meaning every time those cells turn over, that next generation is getting less information, less blood flow, less nutrient. So day one, let's say we talked about 60% taken right off the top, meaning day one, we've got 40% of those messages making it out to that kidney. We know it's getting worse with time. So let's say 5 years go by, now we're down to 20%. 10 years go by, now we're down to 10%. 15 years go by, now we're down to 5%. Eventually, what's going to happen to that kidney? It's going to shut down. We're going to hit that 0%. And when that happens, okay, we've got a dead kidney in our body. And that's a real kidney that had to be taken out of somebody's body. In defense of that, if you got a dead kidney in your body, we better take it out because it's toxic. It'll kill you. But like I always say, jump in your little time machine, go back. Just a routine check of that person's spine by a chiropractor who should be checking people's spines for subluxations. That's what we're supposed to be doing. But just a routine check of that person's spine would turn up that subluxation, and that subluxation can be adjusted, and that degeneration can be stopped, and regeneration can happen there, and that whole downward spiral can be avoided, okay? Unfortunately, not all chiropractors, and in fact, most chiropractors aren't doing that. They're not checking people for subluxations. How do you know if you have a subluxation? Well, how do you know if you have high blood pressure? Can you feel high blood pressure? No, it's the silent killer, right? Same thing with high cholesterol. Can you feel high cholesterol? Silent killer. They call these things the silent killer. Can you feel a cavity? Not a silent killer. But when it's like 60% of the way through the enamel, we start to feel it, okay? Osteoporosis. Can you feel osteoporosis? Oftentimes not until you break your hip and you fall, right? And can we feel cancer? Oftentimes, by the time we feel it, it's too late, all right? So all of these things have something in common with that subluxation, meaning we can't feel it oftentimes until it gets to a point of degeneration where there's going to be some work that has to be done there. So we get checked, we get screened for those things. And that's why I think it's important that chiropractors go back to the basics. Start checking people for a subluxation. Doing these functional exams. We've got technology that we didn't have even 20 years ago, where we can actually look at the functional parts of those nerves, and we can measure that. Like this guy, we did that functional scan, and we literally found pressure on those nerves going out to his kidneys, okay? And then what we do, we see there's pressure on a nerve. That doesn't equal subluxation, but pressure on a nerve plus misalignment in the spine, putting that pressure on that nerve equals subluxation. So we take that x-ray. You'd be amazed how many people that come in here that have seen other chiropractors that say, yeah, well, he never took an x-ray. He just did, he laid me on my side, grabbed my butt, grabbed my shoulder, wrenched me one way, flipped me over, wrenched the other way, put me on my face, did 3 cracks up the middle, put me on my back, spins my head left, spins it right, and sends me out the door. That's not chiropractic. I call that the flying 7. That's just a general manipulation of all the joints in the spine. It actually comes from osteopathy, which is more concerned with blood flow, and doing general manipulations increases blood flow. So I'm not saying there's not benefit to that, but if we've got a subluxation, that's a very specific, like we said, maybe a 1 millimeter misalignment of one vertebrae on top of the other. we've got to find that and we've got to reposition that. But most chiropractors, most medical doctors don't really care about a 1 millimeter misalignment. It's going to take some specificity to find that and specificity to correct that. Okay, so I'm going to leave you guys with a quick story and an action step. And the story is about my very first chiropractic patient when I was in chiropractic school. Duke is his name, not Duck. He's Mung. And when Duke was born, he was developmentally delayed, which meant by the age of 18, he walked a little slower, talked a little slower, but still a sharp kid. One day he's walking down the street in St. Paul where he lived with his dad, and 4 guys in a car saw him walking down. Supposedly this was gang related, but saw him walking down the street, and they jumped out of the car and they start harassing Duke. And Duke runs down an alley to try and get away from them, and they caught him. Okay, he ran a little slower. They caught him down this alley, and so they start beating him up, and they beat him until he's on the ground, and then they continued beating him until he stopped moving, and then they continued beating him until he stopped breathing. And then they picked his body up and they threw him in a dumpster, and they ran off and they left him there for dead. And by some miracle of God, somebody saw this whole chase occurring, and they called 911. And the cops got there, and they found Duke in this dumpster not breathing, got him out, started CPR. The ambulance got there 20 minutes later, and they stabilized him, which meant he was breathing. But he was in a coma for 4 months. And when he came out of that coma, he was paralyzed, but not like somebody who had had a car accident where it's like neck down, waist down. It was like somebody who had had a stroke or a brainstem injury, where it was his entire left side is paralyzed, his face, his arm, his leg. But what wasn't like the stroke was the right side, which was just severe searing pain, like it was on fire. So he woke up literally just screaming in agony, and they're drugging him up, and they're running tests, and they're trying to find what the heck is wrong with this kid down in St. Paul. And they have no idea what's wrong with this kid, so they send him down to Mayo. And Mayo injects some dye and does some tests and runs imagery that, we don't have here. And they're not finding anything, so they send him home with morphine, which is kind of like saying, your kid's going to die, be comfortable while it happens, right? He didn't die. He went on with like that for over a year, and his dad said after a few months of that, it literally drove him out of his mind to the point where he just was elsewhere, and his body is just there, his eyes rolled back in his head, he's drooling, and he's being fed through a tube, and he's just wasting away. And one of Dad's friends that he worked with said, why don't you get Duke checked by a chiropractor? And his dad said, well, because he doesn't have neck pain, back pain, headaches, right? That's what chiropractic's about. He's paralyzed, and he's a vegetable. And this guy said, well, a chiropractor is really the only one that's trained to detect this. And he talks about a subluxation potentially being a 1 millimeter misalignment. And his dad's like, okay, well, this might be worth getting him checked, but I want the cheapest clinic that you can find, which happened to be the school clinic where I worked, where they should have probably paid people to get adjusted because we were that bad. But his dad literally carried him in, laid him down on the table, and took his shirt off, and I saw just the scars all over his body. And he's withered away, less than 100 pounds, just skin and bone. I can count every rib. Eyes rolled back in his head, drooling. And I'm thinking, this kid is going to die. I don't want to be the last one to touch him. I'm scared to death to touch him. And apparently my supervisor was thinking the same thing, because he said, well, John, he's your patient. You do the analysis, adjust what you find, and just don't expect much. That was his sage advice to me. So I did that analysis, that functional analysis, and I found a pressure up at the level of the brainstem. So this is actually a fiber optic view of the brainstem from the level of the first cervical. So up here is the brain. Here's the brainstem going down that canal that becomes the spinal cord. And here, branching off, that's those nerves, okay? So I found pressure up there. So we took him down to the x-ray room, and we laid him down. We opened his mouth, and we shot an x-ray of those top 3 bones. And I'm measuring everything out, and I find a 3 millimeter misalignment. Okay, like the thickness of a dime. It's pretty small. But I got excited because that's like my first real subluxation. and I want to adjust this thing. I only know how to adjust this. There's like dozens of different ways to adjust that. At that point in my career, I know one way to adjust this thing. He's got to be sitting up for me to do it. So the three of us are there holding Duke up in this chair so that I can get on this bone with my thumb and set that bone. And it clunked right in. And I'm all proud of myself. And I look at Duke's dad, and I'm all waiting for a pat on the back. And he's like, that's it? That's all you're going to do? And I went, oh, well, you can bring him back in a couple days, and I'll check him again. And I don't speak Hmong, but I'm pretty sure he was cussing. And he picked Duke up, and he walked out the door. And I was freaking out because I seriously thought this kid is going to die. They're going to come back. They're going to blame me. And we don't hear anything for a week. And a week from the day that I gave him that adjustment, I'm sitting down in the student lounge reading the funny papers, and I hear running down the hallway, and Dr. Kelb, my supervisor, busts open the door. He's like, John! I went, what? He said, Duke's here. I said, thank God he didn't die. He goes, you're not going to believe this. Come with me. So we run down the hall. We open up the door. There's Duke sitting upright on this bench, smiling at me, just big smile. And there's his dad over in the corner, just bawling his eyes out. And his dad told us a week from the day that you gave him that adjustment, he woke up. Like, he literally woke up out of this sleep, and he has no more pain on that right side of his body. And he actually has movement and some strength on that paralyzed side of his body. Okay. So they called that a chiropractic miracle. And I believe in miracles, but you can't qualify a miracle, okay? Either it's a miracle or it's not a miracle. But I think this is the miracle. This is how the body was made. This is how the body will function. This is how the body will heal if it doesn't have interference. And that's what a chiropractor does. We just check people for that interference, for that subluxation, and then we remove it, and we let the body do what it was designed to do. And a lot of times, the recovery can be something that seems absolutely miraculous. And I think we would have more of these miracle stories if more of those people got checked. So that's my action step to you. Number one, even if you've been to a chiropractor before, if you've never been checked, if you've never had a scan, an x-ray, get checked, okay? And we open that up for anybody who shows up here or tunes in online. We do that at no charge for you guys, just for listening to me yap for a half an hour. So if you're interested, give us a call, or we can make an appointment. And with that, we'll wrap it up. And if anybody has any questions, we'll take questions. But you can wrap it up. Thank you, guys.